So the key messages in the report are that the current system for disability support is poor. I'll talk more about that later. We're proposing 2 new schemes, not just one. There are many complex design issues in going from where we are now to this reform. The PC believes that they're achievable. There are practical solutions to these issues. We think there are many groups of stakeholders who can be positively involved with the right motivation and attitude. And even though the costs are scary, given the size of the Australian economy and other areas of expenditure, the Productivity Commission regards this scheme as manageable. So moving on to the key problems with the current system. The words that the Productivity Commission uses in this report are things like inequitable. We thought it best to use them as models to encourage other states to produce similar schemes, and that way provide a secure set of systems for people who sustain a major disability as a result of an accident. We propose that system would be funded from state resources, and we think that at least for the motor injury part of it, it can be up and running within a couple of years. States have been working on this for some time, and we think it's achievable in a short time frame. Just one more thing on that. This scheme is meant to be prospective, so it's for new injuries. There'll be around 800 people per year in it as it starts, and at its maturity there'll be about 20,000 people in the scheme. Just to give you some idea of the magnitude of that. Currently the TAC, which for those of you from Victoria would know is a fairly well-established and large system, currently has about 3,000 people, so something nearly 10 times as big as the TAC. Moving on to the bigger scheme, which we're calling the National Disability Insurance Scheme, or the NDIS. Effectively, this scheme provides universal insurance cover to any Australian of working age or younger who sustains a significant disability. We estimate there'll be about 360,000 people who receive an individual funded package. I'll talk more about that in the next slide. The total cost of this scheme is large. We estimate it's around $12 billion in total. There's currently around $6 billion spent by the states, so a net additional cost of double what we're currently spending. And we're proposing that it be funded from consolidated revenue, effectively by a sort of a tax swap between the Commonwealth and the states. We're proposing that this scheme be rolled out in 2014 on a large population pilot. I'll talk a little bit more about implementation later on. In the meantime, we're proposing that funding start to flow into the system from about 2013 in the establishment of a National Disability Insurance Agency. Next slide. In presenting the coverage of the scheme, we're presenting it as a 3-tiered scheme. At the largest level, there are 22 million people in Australia, and all of those of working age or younger, effectively under this proposal, would be insured against sustaining a major disability. That would give them an entitlement to care and support, which doesn't exist at the moment. If you get sick at the moment, you have an entitlement to go to a hospital. If you sustain a disability, you have no entitlement to receive any care and support, and many people with a disability don't receive any care and support. So this scheme is a fundamental change in the entitlement to what we would call a basic human right. With Tier 2 of the catchment group, if you like, are those people who report as having a disability, according to the definitions of the Australian Survey of Disability Ageing and Carers. There are about 4 million people who report in this way. Many of those people, it's our judgment, I suppose, that would be able to support their disability without an individual funded package. And those people would receive access to information, websites, support in engaging with the publicly available responsibilities of the mainstream services. We think there are about 360,000 people in Tier 3 which are the group that we propose would receive an individual package. And those people are of three main sorts: those that have an activity limitation with a core activity on a regular basis, those being mobility, communication and self-care. People with an intellectual disability who might not have an activity limitation for a core activity but do with employment or education or other activities of daily living. And the third group is those who would benefit from early intervention. And the main types of people in there are children, children with conditions such as autism who, with early intervention at a young age, can have a very different life pathway than if there is no such intervention. Or alternatively, people who sustain a degenerative condition whereby if they receive support in the early days of those, such as multiple sclerosis, for example, they might have a prolonged participation in both employment and social activities before their condition deteriorates, if it does, to where they would need a more substantial support package. Yep, thanks, Mark. Looking at the structure of the scheme, I suppose the fundamental vision of the scheme, it's from we think they'll need help to do that. We're proposing a entity such as a disability support organisation, which would help people to, in the early years anyway, build up their capacity to be able to direct their own support. The package that's available to people would be, they would be able to purchase or direct support from a range of providers. Along the bottom there, we suspect they will be existing NGOs. There may be for-profit organisations who come in. We're proposing that the existing state schemes may morph into state-based service providers, which people might choose to use. And we suspect there will be new specialist disability agencies that form. What we're hoping is that the current suite of services in inverted commas, might be replaced by more innovative ways in which people get support needs. And the creativity that will be required to develop those new support needs can only come from the people with disabilities themselves. The governance structure we're proposing will be a national disability insurance agency, which will be a national body, and that body will be represented throughout Australia by local case managers who would manage the day-to-day operations at a local level.
5 minutes, John.
Thanks, Michael. 5 minutes. Okay. What's in and out? I'll do this quickly. It's easier to say what's out. We sort of proposed that this scheme would be an innovative and comprehensive scheme, providing the support needs for people, except where those support needs are more appropriately provided by mainstream services. So we're not proposing to take over public health, public transport, public education responsibilities, public housing. And in fact, we're anticipating that the NDIA would be an agency for ensuring that those mainstream services meet the responsibilities that they undertake. Aspects of mental health, we've asked for more information, more submissions for people on where mental health fits in the whole thing. Thanks, Michael. Next slide. I can skip over this slide. I think I've mentioned that many people will be involved. The notion of who will run the NDIA, we're proposing an independent board which would be appointed by the states to give states some ownership of the scheme. We're also proposing that within the NDIA there would be an appeals mechanism, an independent statutory appeals officer to hear disputes or disagreements about entitlements. Ultimately, on disputes about legal issues, there would be recourse to higher courts. Thanks, Michael. We think there are impacts for all of these people. Australians get coverage, entitlement. People with a disability get a chance to run their own lives in a way they've never had before. Carers, families of people with disabilities, have an opportunity to avoid the death spiral that I spoke about earlier. The early intervention and the respite services will allow them to continue the important role that they play, and I emphasise that this scheme is not intended to replace the support that's provided by family or the communities, but rather to support it in such a way that it can continue. No system will ever afford to cover the whole of the needs of people with a disability. Providers I've spoken about. Workers in the system, we're anticipating that they have the opportunity to morph themselves from working in a fairly depressed and ration system to one in which they can really see results coming out of their efforts in a productive and outcome-focused way. States and territories and the Australian government, what's in it for them? A lot of work to hopefully get agreement to get this scheme across the line. The negotiation between the states and territories is a major issue in going forward with this scheme. Just quickly, the last couple, timetable. We're proposing this, that the talking obviously starts immediately and the government at all levels is interested. The proposal is that this scheme be discussed at the first meeting of COAG after the final report. 2013, we're proposing that the NDIA be established and start to build its infrastructure. 2014, we're proposing a rollout in a whole of population region. There's lots of uncertainty around the data and the actual take-up of the scheme, and we think that a whole of population trial is necessary to understand that a bit better. And over the period 2015 to 2018, a rollout to the whole of the needs base. We have a priority in mind of the way in which that would roll out, with those most in need and new disability and children being the first cabs off the rank. And I think that'll do it. I've talked a bit about the end table for NIS already. So thank you very much. I'm happy to take questions after the other speakers.